The last 10% may also represent a goal that's never been clearly defined. I want my knee to feel normal. Sounds straightforward, but normal can refer to several different things. It might mean walking without a limp, getting up from the floor, kneeling at a church service, playing 18 holes of golf, managing a full travel day or a full work day, or simply reaching the evening without thinking about your knee joint. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm Michelle. Have you ever caught yourself saying, I'm about 90% better, but struggle to explain what the last 10% actually is? You may be walking independently, driving, shopping, traveling, and participating in most of your normal routine. Yet your knee may still feel stiff when you first stand up. Stairs may require more attention than you expected, or walking may not feel completely automatic. At the end of this episode, you'll have a clearer way to understand what may still be improving, what may simply feel different, and when an unfinished feeling deserves another conversation with your healthcare team. I hear versions of this all the time from people who are several months or even a year or more past knee replacement. Some say they're 85% better, others say 95%. The exact number changes, but the experience, it seems to be similar. They know life is easier than it was before surgery, yet their knee has not completely faded into the background yet. That remaining percentage can become surprisingly distracting. Once the major pain has improved and basic independence has returned, smaller limitations become easier to notice. Early on, getting in and out of bed or walking to the bathroom may have been the day's major accomplishment. Later, the standard changes. Now you notice that you still use the railing on stairs, hesitate before stepping onto uneven ground, or feel tired after an afternoon that would not have seemed demanding years ago. Nothing necessarily went wrong. You may simply be seeing the difference between having less pain and having fully restored physical capacity. One reason people might feel stuck at 90% is that they compare today's knee with the knee they had before arthritis even entered the picture. They remember hiking without thinking about every step, kneeling in the garden for an afternoon, or spending an entire day on their feet without paying attention to either knee. That memory can become the benchmark even when it reflects how they moved 20 or 30 years ago. But what about the final year before surgery? How far could you comfortably walk? Were you turning down trips because you were concerned about keeping up? Did you pause before climbing stairs? Were you planning errands around how long your knee would tolerate being on your feet? Arthritis usually changes life gradually. You walk a little less, choose a closer parking space, stop taking a certain staircase, or let someone else carry the laundry. Each adjustment is small, and it's small enough to seem reasonable. But over time, those adjustments become your normal routine. Once surgery reduces the arthritic pain, it can be easier to remember the distant past than the limitations you were living with immediately before the operation. Another reason the last 10% can feel elusive is the expectation that your artificial knee will eventually become indistinguishable from the knee you were born with. A knee replacement can become comfortable, dependable, and highly functional. It can allow you to return to activities that severe arthritis has taken away, but it does remain a reconstructed joint surrounded by muscles, tendons, nerves, skin, and other tissues that have been through both years of arthritis and a major surgery. Some people do, however, return to feeling like their knee replacement is their natural knee, though this doesn't happen to every single person. You may occasionally notice pressure at the front of your knee, a patch of numbness beside the incision, clicking from the components, stiffness after sitting, or an unusual sensation when kneeling. Some people notice their knee joint after a long day or a sudden increase in activity. Awareness of your knee does not automatically indicate damage, loosening, or failure. A helpful question isn't usually simply, do I ever notice my knee? It's often, how often does my knee interrupt my life? 3 months ago, you may have thought about it with every step. Today, perhaps you notice it when you first stand, then forget about it while talking with a friend or walking through a store. You may go several hours before it crosses your mind again. And that's meaningful progress, even though your knee has not become completely invisible. Research supports the idea that improvement after knee replacement is not captured by one simple percentage. Self-reported function often improves substantially during the first 3 to 6 months. Performance-based measures, including walking speed and other physical tasks, can follow different and more variable courses. People may report feeling much better while still demonstrating limitations when a task becomes faster, longer, steeper, or more demanding. That difference helps explain why you may be pleased with the surgery and still feel like it's unfinished. Pain relief, daily function, strength, endurance, movement quality, and confidence do not always improve at the same rate. Consider walking on stairs. You may be able to climb them using a normal alternating pattern, but still depend heavily on the railing. Going down may remain slower or less controlled than going up. And that final portion is often less about the new joint itself and more about the strength and control required to lower your body safely onto the next step. The quadriceps muscle at the front of your thigh has to control that descent. Your hip muscles contribute as well. If those muscles are still weaker than they were before arthritis, you may find yourself using the railing, shifting your weight to the other leg, turning slightly sideways, or dropping more quickly onto the lower step. The task gets completed, but it doesn't feel natural yet. Walking can create a similar experience. You may be able to walk through the grocery store, but tired during a full day of sightseeing. You may move comfortably on a smooth sidewalk, but become cautious on grass, gravel, or a crowded path. You may walk well when concentrating and notice an old limp when you're tired or distracted. Those are not necessarily signs that anything's really gone wrong. They may show that ordinary walking has returned before the higher levels of strength, endurance, balance, and automatic movement needed for more complex situations. If walking still feels awkward, uneven, tiring, or unlike your old pattern, I wrote a concise book called Walking Like Yourself Again After Knee Replacement. It explains why walking can continue to feel different and how people gradually rebuild smoother, more confident walking for everyday life. The link is in the show notes if you'd like to check it out. There's also a difference between capacity and participation. Capacity is what you can do under controlled conditions. Participation is what you actually do in daily life. You may be able to walk for 20 minutes when you set aside the time, wear the right shoes, and choose a level route. But perhaps your normal day still contains long periods of sitting. You may be capable of climbing stairs, but continue to avoid them out of habit. You may have enough strength to rise from a chair without your hands, yet still push from the armrest because the pattern became familiar. Surgery can change what your joint allows. It does not automatically rebuild every activity that disappeared during the years before surgery. Returning to those activities usually requires repeated exposure. Your body needs opportunities to use this new capacity in your ordinary life. That does not require turning every day into a test. It may involve choosing the stairs once while the elevator is also available, walking a little farther through the store, standing during part of a conversation, or carrying a light bag when that's appropriate for you. The goal is not usually to choose exhaustion. It's to reconnect physical ability with a life that you want the ability to support. The last 10% may also represent a goal that's never been clearly defined. I want my knee to feel normal. Sounds straightforward, but normal can refer to several different things. It might mean walking without a limp, getting up from the floor, kneeling at a church service, playing 18 holes of golf, managing a full travel day or a full work day, or simply reaching the evening without thinking about your knee joint. Until the goal becomes specific, it may be difficult to know whether the missing piece is strength, mobility, balance, endurance, skill, confidence, or an expectation that no implant could realistically meet. Suppose someone says, I'm 90% better, but I still can't get off the floor. That's a specific functional problem. It can be assessed. A physical therapist can look at your knee motion, leg strength, hand support, balance, and the sequence being used to move from the floor to standing. The person may need a safer strategy, more hip and thigh strength, or practice using a stable surface. If that's the case, you might want to check out one of the future episodes where I'll talk about transferring to the floor and getting back up again. Another person may say, I'm 90% better, but I still notice my knee when the weather changes. If daily function is good and no concerning symptoms are present, That occasional awareness may not require a new rehabilitation goal. It may be part of living with your new prosthetic joint. The percentage sounds the same, but the situation is very different. This is why chasing a perfect score can become frustrating. Every time one limitation improves, your attention may move to the next smallest difference. First, you want to walk without a cane. Then you want to walk without thinking. Then you want to walk farther, faster, on hills, and through an entire day. Progress creates new expectations, which is often a good sign, but it can also make the finish line keep on moving. There's nothing wrong with continuing the pursuit of meaningful goals. The key is to decide whether the goal improves your life or simply proves that your knee is perfect. A useful way to judge progress might be to look across several areas. Think about what you can do, how much effort it requires, how you feel afterward, and how often your knee changes your plans. You may discover that an activity is possible, but still inefficient. You may find that the activity feels good, but your endurance is limited. Or you may realize that you're physically capable, but you've not attempted it because you're unsure what is safe. Those distinctions guide the next step far better than an overall percentage. They can also help you decide when another professional assessment is worthwhile. If you've reached a genuine functional plateau, a physical therapist can compare your operated leg with the other side, observe your walking and stair mechanics, measure strength and motion, and identify whether your current program still matches your goals. Rehabilitation after knee replacement should be individualized. Someone returning to a demanding job, caring for a spouse, hiking on uneven terrain, or trying to get safely onto the floor may need different training than someone whose primary goals are household mobility and comfortable community walking. The exercises should really serve the destination. You may also need to reconsider dosage. A program that was appropriate 6 weeks after surgery may no longer provide enough challenge at 6 months. 10 easy repetitions of an exercise can remain useful for movement practice, but they may not be sufficient to build the strength required for stairs, hills, carrying, or rising from a low seat. Strength training should still be progressed carefully and in line with your surgeon's and physical therapist's guidance. Yet, careful does not have to mean permanently easy. Muscles adapt when the tasks gradually ask more of them. That may involve added resistance, slower lowering, greater range, additional repetitions, or a more demanding functional variation. Walking deserves that same thoughtful progression. Adding a large amount all at once can leave your knee irritated and make it difficult to know what caused the response. Gradual increases provide information. You can observe how your knee responds during the activity, later that day, and the following morning. A temporary increase in stiffness or muscle fatigue after a new challenge is different from rapidly increasing pain, major swelling, new instability, or a loss of function that continues. Those changes deserve attention, rather than being dismissed as the last 10%. Persistent or worsening symptoms should not be explained away with encouragement. Contact your surgeon or another qualified clinician if you develop increasing pain, warmth, redness, drainage, fever, new calf pain, shortness of breath, a sudden loss of motion, repeated giving way, or a major change in your ability to bear weight. A knee that has been doing well and then changes substantially also deserves medical review. For people with ongoing pain months after surgery, the goal is not to assume that more exercise will solve everything. Persistent pain can have several contributors, and a structured evaluation is appropriate. If you feel a bit conflicted about your pain because it changes from day to day, I wrote a concise book called Making Sense of Pain After Knee Replacement. It offers a clear way to understand what you're feeling and prepare for more useful conversations with your healthcare team. Check out that link in the show notes if that's something interesting to you. Most people are not describing severe or escalating pain when they talk about the last 10%. They're describing smaller gaps between functional and feeling fully effortless. Effortless movement often returns later because it depends on repetition. When you have practiced a task enough times, your attention no longer needs to supervise every detail. You stop thinking about where to place your foot, how much to bend your knee, or whether your leg will support you. The task becomes familiar again. You may notice it first in brief moments. You walk across the kitchen without monitoring each step. You stand from a chair while continuing a conversation. You reach the bottom of the staircase and realize you didn't think about every step. These moments are easy to overlook because the achievement is the absence of attention. If you tend to focus on what's still missing, consider keeping a simply monthly record rather than grading your knee every day. Note a few activities that are relevant to your life, such as walking duration, stair use, getting up out of a chair, shopping, gardening, travel, or sleep. Monthly comparisons can reveal changes that disappear inside the ups and downs of individual days. You can also ask someone close to you what they've noticed. They may see that you're walking farther, accepting invitations you used to decline, standing through a social event, or joining activities that arthritis had gradually removed from your life. They're often looking at the whole picture, while you might be focused on one stiff knee morning or one difficult staircase. If you enjoy having practical knee replacement education and research updates collected in one place, you can join the Total Knee Success Insider newsletter. I share additional education there to help you make informed decisions and keep your goals connected to daily life. When you describe yourself as 90% better, pause before deciding that the remaining 10% is one single problem. Give it a name. Is it stair control, walking endurance, kneeling, strength, balance, a patch of numbness, occasional stiffness in your knee, concern about damaging the implant, or the wish that your knee would feel exactly as it did decades ago? Once you name it, you can decide whether it needs training, practice, reassurance, medical assessment, or acceptance of a sensation that does not limit you. The last 10% is not always one more exercise, one more degree of motion, or one more milestone. Sometimes your strength continues to grow. Sometimes a task becomes easier through repetition. And sometimes the remaining sensation stays present, but stops influencing what you choose to do. One day, perhaps without planning it, you may finish an entire afternoon and realize that you've hardly thought about your knee. It didn't disappear or become the knee that you had at 25. It simply carried you throughout the day and without asking to be the center of your attention. For many people, that's what the last 10% eventually looks like. In episode 93, we're going to focus on one activity that often remains inside that final percentage, and that's kneeling. We'll look at why kneeling can feel painful, pressurized, numb, or frightening after knee replacement, what the research says about the ability to regain it, and how graded practice may be used with the approval of your surgeon and rehab team. Thanks for joining me. I'm Michelle, and this has been the Total Knee Success Podcast. This podcast is for educational purposes only. Discover more at TotalKneeSuccess.com, and be sure to subscribe and share, because every step forward takes you closer to living the life you love.